Grandfather of two, Philip Dyer knows all too well how painful it can be to have an enlarged prostate, a debilitating condition that King Charles has now been diagnosed with. The 70-year-old retired chef, from Kent, was left in excruciating pain as he was unable to pass urine, and as he was fitted with a catheter, was left pulling his hair out in frustration until a simple procedure cured him. This week, the palace announced that the monarch is going to be treated for the benign condition with a corrective procedure. However, they have not confirmed which type nor his symptoms. Just hours after the news was announced of the Princess of Wales' successful abdominal surgery, Buckingham Palace said, "In common with thousands of men each year, the king has sought treatment for an enlarged prostate. His Majesty's condition is benign and he will attend hospital next week for a corrective procedure. The king's public engagements will be postponed for a short period of recuperation." In 2018, Philip first went to his GP with symptoms. He was prescribed medication to deal with the pain, but it wasn't until 4 years later in 2022 that he learned of his diagnosis and was finally relieved of his painful condition. Reflecting on the peak of his symptoms, Philip recalled to the Mirror, "I was 150 miles from home on a weekend golfing trip with some friends. We played a round of golf, followed by a pint of beer, and that's when it happened. I stopped being able to pass urine. At 4 a.m. that Saturday morning, I made the decision to drive home. I did everything I could to try and pass urine, but nothing would work." Philip was rushed to hospital the following morning, where his bladder was emptied of 2 liters of liquid with a catheter. The medical team told him that even a quarter more of liquid would have flooded his kidneys, leaving him hooked up to a dialysis machine. He had to return every 2 weeks to be monitored. However, there was limited progress. "It was an awful time for me. It felt undignified and painful. I didn't know what to do next. I was pulling my hair out," he said. "I'd never been ill before, and I was frightened. I was becoming mentally unstable. I didn't like that when I laid in bed I couldn't move, and if I did turn over it felt like I was being kicked in the nether regions. It was awful. I just had a plastic pipe sticking out of my penis, and it wasn't a way to live." 6 months after the catheter was first fitted, Philip met with the urology consultant at Kent and Canterbury Hospital for his first cystoscopy, where a camera was inserted into his penis. Once the camera was inside, the doctor said that my prostate had grown so much that it had split into 3 lobes, and one of the lobes had dropped into my urethra, blocking my urine flow, he explained. The consultant diagnosed Philip with an enlarged prostate, also known as benign prostatic hyperplasia, BPH, which affects up to 3 million men in the UK, with the chances gradually increasing with age, from 50% among men between the ages of 50 and 60 years, to 90% for men older than 80 years of age. He was told he was an ideal candidate to undergo a transurethral resection of the prostate, TURP, which involves cutting away a section of the prostate. But following a chance meeting with a patient in the waiting room, Philip had second thoughts. "As I sat in the waiting room, I got chatting to a patient who was waiting for the cystoscopy procedure. He told me that it was his 6th one. I asked him if it hurt, and he said it wasn't pleasant," he continued. "I then asked him what his condition was, and he also had an enlarged prostate. However, had already had the TURP procedure done over a year ago, and was still self-catheterizing. At this point, I made the decision that I was not prepared to have TURPs, because I didn't want to be incontinent or to lose my sexual function. That was no way to live my life." Philip resorted to doing his own research and came across alternative treatments, including aquablation therapy, also known as transurethral water jet ablation. The therapy is a robotically assisted heat-free water jet treatment, which involves injecting a high-speed jet of water into the prostate to destroy some of the prostate tissue and widen the urethra, and last year was recommended by the National Institute for Health and Care Excellence (NICE) when treating lower urinary tract symptoms due to an enlarged prostate. After coming across the therapy online, Philip reached out to Neil Barber, a consultant urological and robotic surgeon at the London Clinic and Frimley Health NHS Foundation Trust, who has been performing the aquablation therapy procedure since 2015 and decided to have the treatment done privately. For the first time in 6 months I was able to urinate without a catheter, Philip explained. I've had no side effects. Everything works normally as it did before and the healing process was very, very quick in both mind and body. I have no regrets and have been able to return to my normal activities. BPH is one of the worst affected elective backlog issues in the NHS, according to reports. It's a high-volume procedure with more than 30,000 men a year requiring surgery in England alone. Some regions have a 2+ year waiting list to be treated. Consultant Neil Barber, who has been involved in global and European trials over the last 8 years for aquablation therapy, and contributed to the publication of long-term data from those trials, said, "Aquablation therapy represents a safe and predictably effective procedure that offers patients, whatever the size of their prostate, a high chance of preserving normal ejaculation, whilst protecting erectile function and continence. I believe aquablation therapy provides a better solution for patients than the standard transurethral resection of the prostate, TURP, which involves using heat to cut away sections of the prostate. In comparison to other treatments, it is becoming increasingly clear that performing aquablation therapy as a day case procedure is not only feasible but safe and could become the gold standard of care when treating BPH. This in turn saves on the cost of inpatient stay, but more than that negates occupancy of an increasingly scarce resource, inpatient beds. What is an enlarged prostate? An enlarged prostate is an increase in the size of the prostate, a small gland located between the penis and bladder. It can affect how you urinate and may put pressure on the bladder, causing difficulty peeing or emptying your bladder. If the enlarged prostate is benign, it's not cancer and is usually not a serious threat to health. It is unknown what causes it, but, according to the NHS, it's believed to be linked to hormonal changes and age. Treatment for an enlarged prostate will depend on how severe your symptoms are, and you may be advised to make lifestyle changes, such as drinking less alcohol, caffeine and fizzy drinks, exercising regularly, and limiting artificial sweeteners intake. A person with an enlarged prostate may be recommended medicine by a health professional to reduce the size of the prostate. Surgery is only recommended for moderate to severe symptoms that have not responded to medicine. What are the symptoms? An enlarged prostate is the most common reason for urinary problems in men as they get older. Here are 6 of the main symptoms, according to Prostate Cancer UK. A weak flow when you urinate, feeling that your bladder hasn't properly emptied, difficulty starting to urinate, dribbling urine after you finish urinating, needing to urinate more often, especially at night, a sudden urge to urinate. You may